If you are a pre-nursing student or a nursing student, I have 5 jobs that would be great for you to start off in the medical field. So if you're interested, then keep on watching. So I'm going to be sharing 5 jobs that I think would be beneficial to pre-nursing and nursing students, just to kind of give you like a feel of what healthcare is like. Even though you may do these positions, because I was a CNA, which is job number 1 that I would recommend, I still felt like there was a lot of new grad reality shock when I did become a registered nurse, even though I was working as a CNA. But I do think it would be beneficial for you to work as a CNA, because the things that you will learn the first semester of nursing school is pretty much gonna be what a CNA would do in a typical day. So if you already have that under your belt, that would be so much easier. Plus, you'll be working with nurses already, which will kind of give you a feel of what nursing is truly like. So that would be my first job recommendation, because obviously I was a CNA, and I give you guys advice based off of my own experience and my own nursing journey. If you don't want to be a CNA, there are also other roles that are similar, and that's a PCT. So that's a patient care technician. Some hospitals, instead of saying they're hiring CNAs, they hire PCTs. Now, job number 2 would be a telemetry monitor technician. And if you don't know what a telemetry monitor is, it's pretty much a device that is put on a patient while they're inpatient, and it's put on their chest to look at their heart rhythm. So what a telemetry monitor tech would do would be, they would be looking at all the screens with all the patients that have telemetry on, and they are looking at everybody's like heart rhythm and seeing if they see anything abnormal. Then they will call and let the nurse know, or they will notify somebody that there is something wrong with that patient's heart rhythm. And usually these heart rhythms are checked like every 4 hours. At least that's how it was when I was working at the bedside as a nurse. The monitor tech would give us every 4 hours the patient's heart rhythm, and if there was anything that was abnormal, then they would call us right away and report that, so that we can check on the patient and then obviously notify the doctor if there was something like truly abnormal. So yeah, that would have been a cool job to know about. I did not know about it until I became a CNA and I was working in the hospital. If it wasn't for that, I would have never known that this job existed. But that would be super helpful for nursing students. If you have something like that available to you within your community, like within the hospital, anywhere nearby you, you should apply to that, because that I think would be like a really good job to have, because you'll already have EKG experience. And my third job recommendation would be to be a unit secretary, also known as a ward clerk. You're pretty much sitting at a desk at a nurse's station, helping with anything that the nurses need, answering phones, anything the doctor needs. You're printing out stuff, you're like reviewing charts, putting charts together, etc. You are pretty much where everything is going on. And I think as unit secretaries, you will learn a lot. You learn a lot about labs, like what is expected, because you'll know kind of like the doctors already. You'll know what they may ask for when they come in. You're pretty much like running the unit, because you're the one answering phones and everything, and if something happens, then you let everybody else know. Now, job number 4 would be to be a phlebotomist. And if you don't know what a phlebotomist is, this is the person that when you go to a lab, they take out your blood. That's what a phlebotomist is. So you could either do it like in an outpatient center, at a hospital. You could pretty much work like, because it's 24 hours. So all these jobs are pretty much 24 hours. So if you're going to school in the morning, then you could either do like a PM shift or a night shift. So these jobs are available for you guys. And the 5th job recommendation that I have would be to work as a transporter. So for like patients who have any x-rays that need to be done, CTs, anything like in imaging, because they would work under the radiology department, the transporter would go pick up the patient in the patient's room and wheel them down like in the wheelchair or the gurney. So they'd be the ones transporting them to go do their imaging. So that's something else to try to get your foot into the door into the hospital to see if you would even like it, or if it would be something that you're interested in. And then all these jobs, like I said, they are great ways to also network with other people within the hospital and try to figure out if nursing is truly something that you would like to do, because you could see it for yourself and you can ask other people. So I hope that you guys enjoyed this video. Make sure to like, subscribe, ring the bell for notifications. I have a whole playlist right here where it's like for pre-nursing and nursing students. So go check out those playlists. I will talk to you guys later.